Anthropology. Definition of anthropology. The concept of anthropology and other sciences. The evolution of life and humanity. Culture and cultural phenomena. Nature and nurture. Myths and beliefs. Cultural attitudes towards health and death. Definition of anthropology. Anthropology, from the Greek anthropos, human, and logos, study, is the science that studies human beings in all their dimensions: biological, psychological, social, and cultural. Aim: to understand what defines humanity, and to explain the diversity of ways of life, beliefs, and social organizations. In nursing, it enables a shift from the concept of illness, a biological process, to that of the experience of illness, a human experience. Anthropology is essential because it helps us to understand patients' behavior, their beliefs, their reactions to the illness, their attitudes towards pain, death, and care. A nurse does not simply treat an illness, but a person with their own culture, values, and history. The branches of anthropology. 1. Biological anthropology studies human evolution, genetics, a man's physical characteristics. 2. Social anthropology studies social relations, the family, human groups, social organizations. 3. Cultural anthropology studies traditions, beliefs, customs, cultural behaviors. 4. Medical anthropology. It studies the relationship between culture and health, beliefs relating to the illness, attitudes towards healthcare. The concept of anthropology and other sciences. Anthropology is an interdisciplinary science. It draws on several disciplines to gain a better understanding of humankind. Sociology. Whilst sociology studies the social structures of modern societies, anthropology focuses on humankind as a whole, traditions, symbols, evolution. Psychology. Anthropology brings a cultural dimension to the psyche, how culture influences our emotions. Biology. It works in conjunction with genetics to understand how populations adapt to their environment. Importance for nurses. Nurses must understand the patient's culture, their social status, his beliefs, his psychological state. This is because two patients with the same condition may react differently depending on their culture, their religion, their education. The evolution of life and humanity. Human beings are biopsychosocial entities. Their evolution has taken place along three axes. A. Biological dimension relates to the human body, its anatomy, physiology, and evolution over time. It explains how the human species has adapted to its environment. B. Psychological dimension. Evolution has led to the development of self-awareness, empathy, and the capacity for abstraction, thinking about tomorrow, imagining gods. C. Sociological dimension. Humans are social animals. They have survived by organizing themselves into increasingly complex groups, establishing rules governing kinship and cooperation. Culture and cultural phenomena. Culture is the totality of values, beliefs, traditions, behaviors, and knowledge passed down within a society. Elements of culture. 1. Language enables communication. 2. Beliefs religious or traditional. 3. Customs ways of life within a group. 4. Values what is considered important. Culture is learnt. It is not passed on through genes. Culture is symbolic. A gesture, e.g. a nod, can have opposite meanings depending on the part of the world. Health-related cultural phenomena. Some crops are happy to accept treatment, others prefer traditional medicines. Examples: the use of medicinal plants, belief in the evil eye, fear of hospitals. Importance for nursing. A nurse must respect people's beliefs, avoid making judgments, tailor the communication. Example: respect religious dietary customs, respect the patient's modesty. Nature and nurture. The innate refers to what is present from birth, such as certain biological characteristics or genetic predispositions. The acquis refers to what is learnt throughout life through education, the environment, and experience. Human beings are the result of the interaction between the TW. Scientific note: these days, we no longer view them as mutually exclusive. We talk about epigenetics. Epigenetic. Our environment, acquired, can influence the expression of our genes, innate. Myths and beliefs. A myth is a symbolic narrative, often ancient, which explains the origin of the world, humankind, life, or certain events. It is not always scientific, but it is of great cultural and social importance. It conveys values, beliefs, and explanations shared by a group. Beliefs are ideas that a person or group considers to be true, even if they have not been scientifically verified. They may be religious, traditional, or family-based. In a healthcare setting, beliefs can influence a person's understanding of their illness, their acceptance of a diagnosis, and their use of modern medicine or traditional remedies. Impact on care. Beliefs can provide psychological support to the patient, or sometimes delay medical treatment. A nurse must listen, understand, explain it scientifically without humiliating the patient. Cultural attitudes towards health and death. A. Attitudes towards health. Perceptions of health vary across cultures. For some people, being in good health means being free from pain. For others, this means physical, mental, and spiritual balance. B. Attitudes towards illness. Possible reactions include fear, denial, acceptance, the use of religion. C. Attitudes towards death. Death has significant cultural and religious significance. Some crops talk easily about death, others avoid the subject. Funeral rites. They differ according to religions, cultural traditions. Examples: mortuary washroom, prayers, quick burial. Nursing role. A nurse must observe the rites, support the family, provide psychological support, respect the patient's dignity.